Hello and welcome to Transfixations. I'm Halcyon Leroy, pronouns they, he, and you are?
I'm Austyn Clemon, pronouns she, they.
Cool. So, Austyn, what do you know about transmasculine strategies for navigating the medical system?
Well, I don't know much, but what I do know is that I'm really excited to hear how you're going to erase women today.
Me too. That'll make sense later. For this first episode, we'll be exploring transmasculine strategies for navigating the medical system, and specifically focusing on the contradictions inherent in being someone who needs two different things from a medical system that are constructed as, like, the opposite of each other, gender-wise. And those are gender-affirming care, from a trans perspective, and reproductive health care from an AFAB perspective. And that can impact behavior in medical spaces, and how transmasculine people need to perform their gender in order to obtain either of those, which I think is very connected to a quote from a transmasculine person, Levi, in the introduction of the book Men in Place, when he said, "I don't have one way to be, I have a bunch of ways, and I decide them situationally." And I think that's really quintessential to, like, trans experiences generally, but also transmasculine experiences in the medical system.
Yeah, that feels like almost a simple but also so impactful and accurate way to, like, describe trans experiences generally, because I feel like I hear so much about trans people talking about how they always feel like they're trying to figure out when can they be fully out, when can we fully express themselves. We're always asking each other, like, okay, new social situation, can I use your pronouns the way that I normally do? Can I use this name? I feel like we ask each other that all the time. Like, not like we, the two of us, but like trans people ask each other that all the time. It almost feels like transphobia has created this landscape where we have to selectively decide which way we are depending on the situation.
Definitely. And we face, like, very different consequences and get treated very differently depending on what decisions we make. And it's difficult and it's hard to be hypervigilant about that constantly. But I think that definitely is a very common trans experience. Diving in, I first want to ask for real what your current understanding of transmasculine experiences in the medical system is.
I guess they aren't erasing women, actually, are they?
Yeah, that's a spoiler.
Yeah. Oh, whoops. Oh, I know a little. I know too much. I've said too much. Pretend that you didn't hear that and that I actually know absolutely nothing. Yay. Okay. Yes. So in the medical system, generally going to the doctor, like, you're going to get a lot of the basic transphobia. You're going to get misgendered and you're going to get called the wrong name. Sometimes even when you change your name legally because they have, like, their own goddamn systems to update.
Yes.
I was right?
Yeah. Unless you have a wonderful secretary at the place where your doctor works named, well, Paul too, but I'm actually talking about Annie, who's this wonderful trans femme secretary who went in and changed all my information for me after I legally updated my name.
That's so nice.
Yeah.
But yeah, I'd imagine you get a lot of that. I'd imagine if you pass, you're going to get a lot of weird looks from doctors when you ask them about, like, AFAB reproductive things.
Yeah. You have a vagina? Really?
Yeah, if you pass, like, you could mention, like, oh yeah, by the way, I need, like, this about my birth control, and they're gonna be like, what the fuck? And you're gonna be like, yes, motherfucker, or something. I don't know.
Yeah, that's on my chart. I said yes, motherfucker, and now I'm...
Oh, really? Are you banned from that establishment?
I wish. But anyway.
So I could imagine there's that. Obviously, I know based on your persuasive speech and forensics and things that you've told me about in the past, like all of the specific to reproductive health related strategies that happen with transmasculine people, especially when they're going to, like, specific reproductive health clinics and abortion clinics, with abortion clinics branding themselves as, like, women's health centers and not feeling safe there, or even getting misgendered in an abortion clinic when there's a goddamn trans flag hanging in the background. I know a little bit about that. I could also imagine, like, with gender affirming care too, you're going to face a lot of the typical things where, like, if you don't say that you want to be a man, they're going to not want to prescribe you tea because they're going to be like, well, why would you want tea if you're not, like, a man? Like, if you're, like, non-binary, then, like, what are you doing here? And it's bullshit. Or if you don't already, like, pass to a certain extent, they're not going to give you tea because they're like, you're not masculine, you're not actually trans. And
wow, it's as almost if I'm seeking masculinizing hormone therapy.
So basically, I could imagine like there's a lot of some of the general transphobia that like I know that like is sort of across the board for trans people, but then also some specific things with like reproductive health care and some specific things with like getting tea and presenting masculine that I can imagine exist too.
Yeah, that is a good overview of what we're going to dive into. So we have a two-part structure. We're first going to talk about gender-affirming healthcare, and we're going to talk about the barriers to obtaining that and strategies for navigating those barriers. And then part two, we're going to talk about reproductive healthcare, the barriers to obtaining that, and strategies for navigating that as well. So yeah, first, transmasculine strategies for obtaining gender-affirming care. So we're going to talk about the barriers. We have so many of them.
Oh dear God, I can imagine.
Yeah, this is going to focus specifically on masculinizing hormone therapy and surgery. Firstly, there's anti-trans legislation. As we all know, over 500 anti-trans bills introduced in 2024 alone already. And according to the Journal of Sexual Medicine in May 2023, in the US, the most common barriers to obtaining gender-affirming care are lack of health insurance coverage and inadequate knowledge by healthcare providers. So we have like the systemic lack of medical coverage and insurance, and then we also have medical providers who, even if they are well-intentioned and want to treat their trans patients well, kind of don't know what they're doing. You'll have medical providers who maybe don't like know any trans people in their lives, and they'll be in, say, like family practice, and then they'll be the one person at their clinic who has the kind of degree you can use to distribute gender-affirming care and prescribe gender-affirming medications or like refer for gender-affirming surgery, and they will never have encountered in medical school like, this is how you use gender-neutral pronouns, or like,
oh my God,
this is how you make sure you're using like the right name for your patient. They'll never get that training, and they won't get it in the workplace either.
Wait, that's okay. That's wild. And also, I've experienced with doctors at Planned Parenthood who are not only like willing and ready and like trained for treating trans people and prescribing hormone therapy, because that's what Planned Parenthood does. They use pronouns fine, like they do all that fine. But like I couldn't even count how many questions I've asked my hormone therapy prescriber, and she's just been like, I really wish I had an answer to that, but I don't know, because like the research on that is like almost non-existent. Like that has happened so many times.
Yeah, that is very similar to testosterone. So like we have these like multiple levels of this problem too, right? Sometimes you can't even get to that point because you don't have health insurance coverage because the medical system is awful. If you can get to that point, sometimes you'll encounter doctors who like don't really know what they're doing, and also don't have good intentions. And then sometimes even when you encounter doctors who have good intentions, who want to be inclusive, who maybe even like know how to interact with a trans person, wow, they still often can't tell you the answers you need about your hormone therapy because the research isn't out there. I actually really like that, even though it is frustrating that your doctors told you they didn't know, because my doctor just pretended to know things and he was very wrong. And then there's also, even when doctors do have knowledge, the barrier of gatekeeping, which I think you mentioned a little bit when I asked you your previous knowledge on this. So essentially, this gatekeeping looks like doctors seeing a transmasc patient and doing a consultation for HRT and deciding for some reason, like either maybe they use they pronouns and maybe they have a feminine name, or like a name that the doctor perceives to be feminine, or like not masculine enough, like halcyon.
It's like you're coming to something like, I would like some of the hormones, please, and they're like, Fern, sorry, bud. Get back in the kitchen or whatever.
Oh God, yeah, pretty much. That's like so accurate. And so essentially it's this model where doctors kind of get to decide whether or not you're like trans enough for hormones, despite the fact that like all the research points towards an informed consent model being more effective because it increases access to healthcare.
You're telling me
that consent is a good thing? Revolutionary, I know.
Wow! You're telling me that when someone walks in and says, I want a cookie, you just give them a cookie, and then that increases access to cookies?
Yeah.
In the statistics?
Amazing, right?
Because it's not like there's a shortage of cookies. We have enough cookies.
We do. And actually, a lot of the cookies are going to like cis people who arguably don't necessarily need them.
I see a goddamn cookie ad every time I drive here from Minnesota.
Yeah, there's that. Are you talking about the billboard that's like testosterone hormone therapy, and it's the cissest man lifting up this woman and like holding her up on like a beach. And it's like, you don't need to get an erection. I need to go on hormone therapy.
I need to get erections.
Yeah. trans people deserve better erections than cis people. Anyway, yeah, despite the fact that an informed consent model is like demonstrably just better for patients, and also the evidence shows that like patients have greater satisfaction with their health, with their providers, with everything. Like it's just better all around. It's also less paperwork for medical professionals. The main practice of care is still this model that allows doctors to deny care and allows doctors to force transmasc people to quote unquote prove they deserve gender affirming care. There are also a lot of laws in place that make it really difficult. Like in Wisconsin, you can't get top surgery until you've been on T for at least a year. You can't even apply to get top surgery before then, actually, I should say. And if you want to, you can, but you need to go off of testosterone during the surgery. And they make up this like really ridiculous reason that's supposedly medical science. They say that the masculinizing hormone therapy will change the like shape and texture of your chest muscles.
That's right.
Which like is demonstrably not true. Like there's no research saying that. They made it up to make this law to make it more difficult to get top surgery.
Based on what you told me, even if it fucking was true, then they'd be lying to you, because when you go on T, they say that like T will not make your chest smaller or like won't change anything about your chest at all, which based on people that I know, including yourself, going on T, like that's not true. But then also, if they're now saying that like you can't get top surgery until you've been on T for a year because T changes your chest muscles, either T changes your chest or it doesn't.
Yeah. I mean, the answer is that it does, and also it's not going to make it more difficult for you to heal from top surgery.
That's ridiculous.
So like kind of neither are true.
This is why I will never, like, on a categorical, like, inherent level, be able to understand cis people. Because
this is such a cisphobic podcast. I think we need to rename it from Transfixations to cisphobe ramblings. I don't know.
No, this is why I, like, on a categorical level cannot understand cis people, because what is it about trans people and, like, your feelings about trans people that is so extreme that you are willing to forego your own convenience? You could make giving trans people healthcare so easy.
It's really easy to get puberty blockers and hormone therapy if you're cisgender.
Cis, yeah.
Yeah.
Again, cis people don't get them.
Yeah, there's nothing to get.
Trust me, I've tried.
But yeah, the last barrier that we're going to talk about before we get into strategies is that transmasc folks often have to like overperform their distress and basically pathologize themselves in order to prove they deserve gender affirming care, especially with gender affirming surgery. There's a lot of states that require a therapist write a recommendation letter and provide like comprehensive documentation of past gender dysphoria and diagnose you with gender dysphoria as if that's a mental illness and not like a feeling people experience when they're trans. And if they like read the therapist's recommendation letter and their notes and just decide on a whim that actually it's still not medically necessary, insurance companies can deny you coverage for the same gatekeeping reasons we mentioned earlier. Like they think you're not the kind of person who deserves gender affirming care, you're not trans enough, or just really because they feel like it. And doctors can refuse you care if they don't think that all of that documentation is legitimate, whether or not it actually is.
I'm just seething in immense rage over here, don't mind me.
Would it make you feel better to talk about how good and nice informed consent models are?
Talking about informed consent almost makes me as happy as talking about puppies.
Wow.
I would love for the entire medical system to be ran by puppies instead of...
Oh, yes. Please.
That sounds wonderful.
That sounds great.
I love it.
Abolish doctors. Puppies.
Yeah. So, yeah, I can share my canine experiences. So, informed consent, just to, like, really, like, lay the actual, like, groundwork and foundation of what informed consent is, because I've studied this and I use this model of HRT. Informed consent is essentially what I think a lot of people refer to as a model of trans healthcare. And what they mean is, like, just a set of procedures that you can standardize and sort of have everybody use in order to make gender-affirming hormone therapy like as the same across places as possible, that like this could be like the model of care that we use and we implemented it as many places as possible to increase access to care. And the way that it works is exactly the way that it sounds, which is if you are a trans person and you want to, for example, go on hormone therapy, it's most often used in hormone therapy, but you can apply it to other forms of trans healthcare as well. You go to a prescriber and you say, I'm trans, I want to get on hormones. And from that moment, like, the decision of whether or not to get on hormones is completely up to you. the doctor that you are going to does not have any say under this model as to whether or not you get hormones.
Yeah. Their job becomes to inform you so you can consent.
Exactly. So what they do is they say, okay, what do you want? Like they'll ask you maybe like what your like transition goals are, like what do you want? And then they'll recommend like specifically like what they want you to take. So for example, I think almost every, if not every Planned Parenthood that does hormone therapy for trans people follows an informed consent model. So I go to a local Planned Parenthood back where I'm from in Minnesota, and I walk in, I see the doctor, and they say, okay, like, you're a trans femme, what are your transition goals, what do you want? And I, like, talk about, like, I want feminization, like, I want, like, full feminization, the whole thing, and they're like, okay, so then we want to get you on an androgen suppressant and estrogen. And then they do that, and they give you, like, some nice sized brochures and packets of information about the things, and then they give you a form and you sign it and you sign for all the consented treatment, and then they send the prescription out. And that is informed consent. They give you the information, you sign the consent form, and then you have hormones prescribed to you. And there is no diagnostic procedure, there is no interrogation about your experiences, there is no diagnosis, there's no decision about whether or not you were like trans enough or even like trans at all. You want the hormones and now you get the hormones.
Yeah, which makes sense because I think that's the same way that you would treat, say, like a postmenopausal, like cis woman who was like worried about her hormone levels, felt really exhausted all the time, maybe didn't have like as high of libido as she wanted, like would come in and be like, hey, I'm experiencing these symptoms and I think it's because I don't have as much estrogen as I would like to in my body. Can I have estrogen? The doctor would be like, yeah, I'll prescribe you estrogen, without ever interrogating like whether she deserves to have estrogen in her body.
Wait, no, we have to figure out, are you a real woman though? Are you actually postmenopausal? Yeah. But that's like what they do to trans people. And like, so like my experiences with informed consent, I think have greatly aligned with the research that like shows that it increases access to healthcare because all I did was make an appointment at Planned Parenthood. And then within half an hour I got hormones, and then I drove to the pharmacy and got my hormones the same day.
Whereas without the informed consent model, when I started testosterone, I had to fill out so much paperwork. My insurance company had to grant a prior authorization for me to be able to get it, which required a letter from my doctor justifying that it was medically necessary, which required a consultation with him regarding like we also talked about what I wanted and what my goals were, but he wouldn't like let me determine my dosage.
That's also very strange though.
And the dosage ended up being like wrong for my body, but he didn't ask me about like any of those things, even though he has my medical history. He just had to ask me about like why I wanted to go on it and like tell me about surgery options later, but in a way that was like, well, if you want this exists, but you'd have to prove it like this kind of thing. And so it was a very different experience. So I think that also validates it from the other side of like
wild.
Accessing testosterone was a nightmare for me and still kind of continues to be when I try to get my refills.
That's wild to me because anytime that my doctors at Planned Parenthood have talked about dosing, they always like gave me information about like these doses and then asked me if I wanted, like asked if it sounded good to me or if I wanted to go lower or higher.
I had to initiate changing my dose because my levels were really high on my lab tests and he just like didn't do anything about it. And I was like, this is...
Even like lowering your dose you had to initiate.
Yeah.
That's, yeah. See,
I
that's
had to like fight for it, yeah.
That almost brings me to the last thing too, is that the other thing that I feel like informed consent has done for me is not only like made it easier for me to like access care in the first place, but it also makes the visits go a lot easier for me too, because when I walk into Planned Parenthood like on the first day, I know that I'm going to be walking out with a hormone prescription. And what that does is that essentially immediately brings all of the like barriers of like what kind of information about my transition would I share with these doctors down, because I know that nothing I could say is going to cause them to deny me hormones, which is the thing that a lot of trans people suffer with, is that you have to present, we've talked about this already in this conversation, is that you have to present a particular narrative of your transness and a particular trans expression and presentation in order to get a prescription. And under the informed consent model, none of that matters because it's all about what you want.
Wow, I really need to go to Planned Parenthood.
I mean, at least the one that I go to is a nice place.
Yeah. So I think having talked about all of the barriers and that system that makes the barriers significantly less, but also still like doesn't necessarily solve the problems of lack of providers' knowledge or lack of insurance coverage, I think we should probably transition into talking about strategies. I'm not going to gatekeep this transition.
Did you hear that, cis people? You get to join us on this one.
It's a fun ride. You'll enjoy it. Okay. So.
Just like you'd enjoy hormones.
So yeah, now that we've talked about the barriers, I think we can talk about the strategies that transmasculine people engage in to overcome and navigate those barriers, specifically within the context of getting hormone therapy and gender-affirming surgery. First, I want to read this wonderful quote that I just think everyone should hear, which I've taken from the abstract of an article published in the International Journal of Transgender Health in 2020, which is, "Transgender and non-binary people are not passive victims to this stigma, and the medical community would benefit from understanding the actions this population takes to resist and reduce transgender stigma in healthcare." I think that's really important because we're talking about all these barriers, we're talking about all this legislation, we're making it sound like, well, not making it sound that way, but it can sound like trans people don't have agency and choice in all of this. And ultimately, there are a lot of ways that we do that are not ideal, but that we can engage in to exist even within these systems that are trying really hard to make it difficult for us to exist.
I love that because it follows from that quotation from chapter 3 of Gender Reckonings, where Schilt writes that scholarship has historically situated trans people as objects of culture. Not only like objects to be studied in like this is a peculiar oddity way, but also even when we're like trying to be quote unquote trans supportive, like he positioned trans people as being like, oh, they're victims of all of this awful discrimination and transphobia, and like we need to save the victims of transphobia. But what that doesn't allow for is the reimagining of trans people as subjects who create culture rather than receive it. In the sense that like by transitioning and by existing as ourselves, we are actually like shifting cultural narratives and cultural norms around gender, because like queer things, like things that came out of queerness, like so many of those are like foundational to culture generally. And so I think that like it is not only more useful and much more like cool for trans people, but also more accurate to say that like, no, we are like shaping the world around ourselves. We do not just like sit here and receive bias and discrimination all day.
Yeah, we are actively participating and subverting and resisting the medical system, and sometimes going outside of it to get what we need. And so the strategies identified in particular by this article published in the International Journal of Transgender Health include using social support to navigate healthcare systems, persistence within healthcare systems to meet one's needs, avoiding mainstream healthcare, and doing one's own research. So I'm going to touch briefly on all of those. So using social support to navigate healthcare systems, I think, is pretty self-explanatory. It's relying on community, relying on found family, chosen family, sometimes even supportive family members. I don't think I would be able to navigate getting medical care and transitioning without specifically my mom's support, like financially, but also emotionally helping me navigate it. And so it's like just kind of relying on other people in your life who support you and who understand to be able to navigate a system that feels very isolating and alienating as a way to resist that stigma and as a way to counteract it and kind of reclaim humanity is a strategy that transmasculine people use, I think, to survive emotionally. And then persistence within healthcare systems to meet one's needs has a lot to do with when your doctor tells you like, oh, well, I don't know if you really want this, or like questions what you want, like, you know, reasserting it and saying like, yes, this is what I want. Yes, I understand this. Yes, I'm making this decision. Being persistent and continuing to seek out that care. And if one provider will not give it to you, going to another one until you are able to get what you need from the medical system can sometimes be a strategy to get access to that care when it's being denied to you.
I love the idea of taking back, God, it's that fucking song, Take Back the Power by the Interrupters. Listen to it. That song is so good.
Yeah. And then the last two for this section for gender-affirming healthcare, avoiding mainstream healthcare and doing one's own research, I think tie in very closely with something I know that you know a lot about and you're very passionate about that I first heard about. So could you talk a little bit more about DIY HRT?
Oh, DIY HRT.
Or do it yourself hormone replacement therapy.
I did fancy gesture hands.
I guess this is an audio medium.
Yeah.
We're excited is the point.
So DIY HRT is basically the informed consent model on steroids. Literally.
Wow. I'm on steroids.
I think that'd be funny to say. Wow, I'm not. I'm specifically on an anti-steroid. Essentially, it's like, imagine if you took the informed consent model, but then like got rid of the doctor part and like the healthcare system part. So it was like still the part where like you are in control of your own healthcare and like you are deciding when and how you get hormones, but the doctor isn't. There's no doctor. You just do it yourself. It's like That's
It's like in the name.
That's like the name of what it is. No, so like literally, the way that this often works is there are places online where you can just buy hormones. You can literally just like look up like, I don't know, DIY, HRT, estrogen shit, or like testosterone. You will find websites online where you can just like order hormones, get them sent to your residence, and then just start taking them.
Yeah. I do want to complicate that though.
Yeah.
Estrogen, it is legal to do that because it is not government regulated in the same way that testosterone is.
Correct.
Do you remember what number of scheduled testosterone is?
3.
Yeah. So that basically means the government gets to decide how much you can get, when you can get it, and basically can restrict the distribution and use of testosterone in a way that is more difficult to do for estrogen because it's not regulated in the same way.
Which is why we in the business like to call the DIY HRT business, obviously like to call that by the proper scientific term, which is bullshit.
Yeah, because I think that testosterone is actually like classified as a steroid specifically to regulate it like that, even though it doesn't actually do the things that other steroids do.
No, it doesn't.
Yeah. And the other thing that makes that difficult with testosterone specifically is that a lot of people who take testosterone choose to take it by injection because taking it orally can actually really damage your liver. So you can take that one of two ways. You can take that intramuscularly, which is big needle, big poke, much at a time, or you can take it intracuticulously. I butchered that word.
Oh.
But that's like right under your skin, and it's smaller doses more frequently. And both of them require you to have the injection supplies, which, depending on state, are also difficult to get online. In Wisconsin, I can get mine legally online. I order them in bulk. That's fine. But in other states, depending on where you live, that can also be illegal, which is another barrier.
That's good to point out. Can I complicate it even further?
Please do.
Because here's the thing. Even though, like, buying buying estrogen online is still sort of illegal, it's less illegal than buying testosterone online.
Yeah.
Because welcome to the government where things are different levels of illegal depending on what you're doing, because of course they are. So even though it is technically illegal to like buy testosterone or like in some states buy the injection supplies online, the U.S. Postal Service doesn't like screen packages like that rigorously for like contraband or illegal things at all, actually. I'm just giving you information. But yeah, that is also like another part of it, is that like it is illegal, and that can be a barrier in some cases, but it also the strength of the barrier is kind of variable depending on whether or not your package would randomly get found out or not, which most of the time it wouldn't.
I would speculate that it is probably lower risk for white trans people to illegally get their HRT online, because drug criminalization of like illegal drugs for people of color is much more intense.
Oh, certainly.
And I think that probably also makes that complicated, where like the racism of it's probably easier to quote unquote get away with getting illegal hormones online if you're white than it is if you're not. With needles in particular, that can also be read as other drug paraphernalia. So actually you can get prosecuted pretty badly for just having needles in your possession that you got online that are not like prescription needles for a specific medication. Because
I didn't think about that.
Can actually assume that you're using it to inject a different illegal substance.
Yeah.
And especially I think if you're a trans person of color, that's all the police usually need to put you in prison.
That's awful.
Promise, I'm just trying to take boy juice. Fundamentally, would you say that like DIY HRT, like it has legal risks, but if you have been denied care elsewhere, and if you are unable to interact with the medical system, you can't get insurance coverage, you can't afford the just like ridiculously high prices of it through the medical system, and you're able to access that online, like that is another way that trans people can use to empower themselves, despite the risks associated with it. Like that is a network that is available to people. That is also a strategy for not just navigating the medical system, but completely doing away with it and saying, no, I am taking this fully into my own hands because this medical system is not serving me.
Absolutely. Because the other thing that you're also going to find online when you look for DIY HRT is a quite extensive internet community. There's one on Reddit. There's also one that has their own website that's called DIYHRT.wiki. And you're going to find this vast internet community of trans people who do DIY HRT deliberately. Some of them because they can't get DIY HRT or can't get HRT within the medical system. Some of them just want to. So like you do your own labs, you measure your own levels, you do all of the things. People do that. And so then that also means that like not only are you getting hormones outside of the medical system, but you are also sharing information in like a underground network kind of way. And you have other trans people around you who are going to tell you like where the best suppliers are, where the cheapest suppliers are, where you know you're not going to get scammed, where you know that you're going to get like hormones that are actually the things that you say they are, so you're not going to get something else. And like trans people have really created this like really, really good network providing hormones for each other that exists completely outside of established medical systems and also like works.
Yeah.
Yeah.
Yeah. So having covered all of those barriers and all of those strategies in relation to gender affirming care, I think we can look at and compare that to strategies for obtaining reproductive health care that transmasculine people engage in, and those barriers, which, as you might expect, has different barriers involved with it, different strategies to navigate those, and requires different gendered performances. Firstly, to talk about the barriers, there's the obvious. Restrictive pre-existing laws on abortion that apply to everyone who might need access to reproductive health care, and not just to abortion, but those abortion laws unfortunately tend to also shut down funding for clinics that provide other services, so generally creating deserts where reproductive health care is not available. And that applies to everyone, especially after Dobbs, but can disproportionately affect gender nonconforming people because we are already predisposed to distrust the medical system for providing reproductive health care to us.
Why?
Yeah, for good reason, and we're going to get into that. It's they don't really deserve our trust, in my opinion, but that also puts us at risk because gender nonconforming people are 3 times more likely than cis women to use risky methods when they want to terminate a pregnancy, purely because they don't feel safe or comfortable in an environment that's going to treat them badly. Yeah. Yeah. Well, okay, let's get into why. So,
yay!
We have
I've just been like hinting at it the whole time.
Good old medical transphobia. So, I want to ask you, because I know that I think you have a lot of accurate opinions about this. How would you predict medical transphobia might play a role in transmasculine people's access to reproductive health care? And how would you expect strategies for obtaining reproductive health care to differ or be similar, kind of overlap with the strategies we just discussed for obtaining gender affirming care?
Well, I think I could immediately think of like an effect that would lead to a similarity to obtaining gender affirming care, which is like medical transphobia would lead transmasculine people to just completely avoid getting reproductive health care entirely from medical institutions. That like, well, if this clinic says that they're a women's health center, like I don't want to take my chances with this. Like I can't deal with that. I can't deal with the prospect that even if it's not a guarantee that they're going to misgender me, I can't deal with that. I'm not going to do that. And so they're not going to get reproductive health care from any medical institution at all. And so then the way that informs their strategies is what they're going to do then is they're going to turn to, like you mentioned, like they're going to turn to self-managed reproductive health care. They're going to do it themselves.
Which can be empowering and can work in the same way that DIY HRT can, but in a landscape where that is criminalized and often risky, it actually, I think, probably has worse health outcomes and risks than DIY HRT.
I don't actually know much about the health outcomes of like self-managed abortions, but I would assume that they're probably riskier than DIY HRT because despite what the medical system would have you think, or despite what like conservative pundits would have you think about like the effects of hormone therapy, like the side effects of hormone therapy are quite minor.
Yeah, you can't
when they exist.
Really die from taking hormones at all.
I think the worst, as far as I understand based on hormone therapy works, granted I haven't looked into testosterone as much as I have into like feminizing hormone therapy.
I know a little bit about testosterone. I can add to that.
Estrogen, basically, some of your health risks for certain things are going to go up to the levels that a cis woman's would.
Yeah.
That's what it's going to be. The worst like risks of side effects and adverse effects for feminizing hormone therapy come with anti-androgens, right? Testosterone suppressants. Because some of those, spironolactone, the one that I'm currently on, doesn't have anything major. A few other ones, though, can cause like severe liver damage if you don't use them properly, if you don't make sure that your levels are adequate. Which is why most people just take spironolactone because it is the safest one.
In regards to testosterone, it's similar in the fact that some of your health risks will go up to the same level that a cis man's might. So like with heart attacks in particular, Testosterone raises your cortisol levels, which can cause stress to your heart over the course of a lifetime, and you might be more likely to have a heart attack, but only as likely as like a cisgender man with testosterone that his body is just making on its own would be. So you're going to have health risks, but just like the health risks of having that level of testosterone that like everyone who has that level of testosterone would, and not really anything more major than that. In regards to self-managed abortions, though, it really depends heavily on the method that you're using. There are safe ways to do it, and those safe ways can be like empowering. For example, mifepristone and its companion pill, while it is still legal, is a very safe, very effective way to have a self-managed abortion at home. In regards to getting access to mifepristone, though, there was the recent Supreme Court case. It's not yet illegal, but its legality is threatened and restricted. So essentially, the one really safe, really reliable method of a self-managed abortion might be disappearing soon. Aside from mifepristone medication abortion, there like other self-managed methods are a lot more risky. There was a really interesting article from CNN that came out like right after the Dobbs decision was initially overturned, interviewing 3 different transmasculine people about their experiences with abortion. And one of them, Oliver Hall, told this story.
Oh, I know this one. I know this story.
He told this story about looking online. So in his hometown, there was a surgical center that was labeled a women's surgical center, and that was the only place that provided abortions. He didn't feel safe or comfortable going there, so they looked online and got a mixture of herbs that was supposed to induce abortion.
Yeah.
Which isn't like a super effective method, but did work for them at the stage of pregnancy that they were in.
I hope at least it was like...
It was painful, though.
Oh, no, okay, never mind. I was like, I hope it was at least like maybe like safe and like not super like adverse effects.
Well,
never mind, I guess it was painful.
They say that it was definitely life-saving care, not because the pregnancy had complications, but because he would not have been able to go on with his life without that procedure.
Mm-hmm.
But because it was a combination of herbs, like there was no numbing of any of the sensations. Like the point of the medication that's usually prescribed with mifepristone, like mifepristone will work to induce an abortion on its own.
Yeah.
The one that's usually prescribed with it is to like dull the painful parts of it.
That's so bad.
Yeah, and so like he did that and it worked with what he could find online, but like they were in a lot of pain. And for a lot of people who do that, either it doesn't work for them or they are in so much pain that it's just an unbearable experience, or sometimes, depending on what you're taking, it's going to kill you. So, like, when you have to turn to self-managed risky abortions, like, it really is not ideal. There should be medical infrastructure that can take care of transmasculine people and everyone, and there just isn't. So that's a major barrier, is medical transphobia, and then outside of the medical system, also the fact that we can't necessarily access things that are safe. But someone working to build that infrastructure, who I want to touch on briefly now and more later, is non-binary reproductive rights activist Jack Kayemi.
Yay! I also know about this person.
They are very cool. They are working to make abortion accessible for non-binary AFAB people and transmasculine people. They're non-binary. They had an abortion earlier in their life, and it was a really pivotal experience for them. They wanted to become an abortion advocate and activist, and then realized that people in their industry basically didn't mention anyone like them. And I have this quote from them saying, some trans people have abortions, some trans people need access to birth control, some trans people could use the clinic access to get hormone replacement therapy. So why is it that in the 5+ years I've been involved in this movement, no one has bothered to even mention people like me?
Holy fucking shit.
Yeah.
Get their ass.
Yeah.
That's so like haunting and like incredibly saddening that they like have to say that, but also just like incredibly powerful. And also I feel angry, and like that it's the kind of quotation that makes you feel like really kind of saddened and just like heartbroken at the systems that be, but also incredibly angry and motivated to fucking do something for once.
That is always how I feel reading things that Jack Hamey wrote, and also looking at their website, because they helped found a activist organization around abortion that I actually want to talk more about later, and that we'll link to in the description. Yeah, so those are the barriers. And then, assuming you can get access to reproductive health care, as a transmasculine person, assuming your insurance will cover it, assuming you can get into the clinic, there are more barriers. Surprise, double layers of barriers. There's the initial barriers of access in the first place, and then once you get access, there's these barriers which are more complicated and, in my opinion, like worse almost. So we're going to split this into two categories.
I love the more the substructure with it's like the individual bones of the skeleton, and they make up like the.
Yeah, this is like
great.
The tibia of the podcast.
Oh yes! Oh my god! I can't wait until we get to the stirrup.
We're about to. We'll get there. We'll get to the stirrup.
I love the stirrup.
Me too.
I love that bone so much. It's tiny. He's so tiny.
Okay, so we have the tibia and the stirrup. The tibia
Yay!
is going to be non-binary and or femme-presenting AFAB people who are genderqueer, and also transmasc people who don't pass. And that category of people is going to experience different barriers than, we'll call them the stirrup, basically consisting of transmasculine people who do pass and are viewed as legitimately masculine, quote unquote, by their doctors.
But in reality, they're just little guys.
Yeah, and that category also contains trans men who also pass. So essentially, we're dividing this into people are going to face different barriers based on gender presentation and or like perceived legitimacy of said presentation by their providers. And for people who are seen as illegitimately masculine or illegitimately genderqueer, they're going to have no problem getting access to reproductive health care, but in that process, they're going to be misgendered, dead named, just generally mistreated, and their gender is kind of going to be not acknowledged. It's going to be erased in that process.
Yeah.
Yeah. The providers are essentially going to just be like, well, you're basically a woman, so you can have reproductive health care.
That's funny because that was actually my gender identity for a while. And then
Basically
I realized that
a
I wasn't.
woman.
Yeah, basically a woman. But then I realized that I definitely was not. And I was like, no, thank you. Not going to happen.
Yeah. I don't think anyone ever really wants to be called basically a woman.
Yeah, no, that's why I stopped doing it.
Yeah. And then the other category of folks, transmasculine people who do pass, like regardless of whether they're non-binary and like being perceived as quote unquote legitimately men or legitimately masculine, or like trans men who also pass, that those people are going to actually be taken seriously with their gender. They're going to be viewed as legitimately masculine, but that then means in providers' minds, they're not going to be like quote unquote worthy of getting reproductive health care because they're not women. So, and reproductive health care is something women need. So they're going to be dismissed. They're going to be mistreated. Oftentimes I've heard a lot of stories of transmasculine people going in for like a gynecological exam, and maybe like their more feminine presenting partner drove them or something, and they'll be in the waiting room and the provider will just like assume that the partner's there to get the exam.
I've heard stories about this too.
Yeah.
Yes.
So it's just basically like, you look masculine, so you definitely don't and can't possibly have the need for reproductive health care.
Oh my God. Those two barriers make a lot of sense because I feel like those connect really, really well back to something that we were talking about earlier, which was like, you asked me like what I thought like some of the barriers for transmasc people would be, and I was like, well, I could imagine that like there's this thing of like, if you pass, like you are treated as a man, but then you can't get like the reproductive health care that actually like works for your body, and like no one's gonna take you seriously when you're like, I could be pregnant.
Yeah.
But like if you don't pass, then you're just basically a woman, and they're just going to be like, you're going to get misgendered. You're not going to get taken seriously when you try to advocate for yourself. You know, cis male doctors are going to mansplain to you what the fuck is going on because they do that to fucking everybody.
Yep.
And that's really like just awful and disappointing. And I feel like those two the tibia and the stirrup,
The two genders.
we've discovered that the tibia and the stirrup have been here all along,
Yeah.
which is very sad actually though.
And it kind of goes back to just like binary constructions of gender, because the fact that if anyone is not passing as like a cis man, they must just be a woman. But if you are passing as a cis man, you can't possibly need access to the same things that a woman, quote unquote, like would need access to. And I think that is very connected to like the language we use, because language like women's rights and women's healthcare plays a huge role in constructing these barriers. It feeds into the transphobia of the medical system, and it's actually very widely used by mainstream reproductive rights movement activists, which is really disappointing. I love referencing this New York Times article as evidence for this, but it's...
Oh God, is this it? Is this it?
This is
Are we
it.
getting to the point?
Yeah,
Oh,
we're
I've
about
been-
to erase women.
I have been waiting for this moment. Ever since the beginning of the podcast, I've been waiting.
Yeah. The title of this article is A Vanishing Word in Abortion Debate.
Oh my God.
Women.
Oh my God.
And
Oh
this-
my God.
Yeah. This article as you might expect, quotes a couple of trans exclusionary radical feminists. We're playing all the hits. We've got J.K. Rowling in here. We've got
Classic.
second wave feminist Ty Grace Atkinson, who actually did a lot of good work with the exception of hating trans people, unfortunately. But this article quotes Ty Grace Atkinson saying this is about women's rights, not language, and making the argument that gender-neutral language and reproductive rights, quote, erases women. So yeah, now we know why that exists in our intro.
Yeah, and now we know the real reason why we're all here today, which is to erase women. Exactly. So in case you were wondering, to everyone listening, this podcast erases women. We are trans people who are going to destroy the foundation of womanhood or whatever rhetoric they use. We're using people and person language instead of woman. And if you feel erased,
you should consider valuing yourself as a person, because person includes everyone.
It's the point when
if you feel erased by the word person, you should probably work on your self-worth.
Yeah.
That is kind of the hole I like to poke in this argument. Obviously, we're not actually erasing women.
Yes.
But that's always the first language that comes up, the first argument that comes up when you talk about the importance of using gender-neutral language in reproductive rights and elsewhere, because they'll say, like, well, this predominantly affects women. And it's like, yes, it does. But when it's not predominantly affecting women, it is disproportionately affecting these smaller, a group of genderqueer people who can't get access to this and who the language just erases from the picture entirely. Because when you're saying women, that generally doesn't include genderqueer AFAB people. But when you're saying person, like, women are people. Controversial, I know. Women are included in the term people.
Yeah. You've explained this to me before, that, like, if you are saying using the word person instead of woman, like, erases women, you are in essence, like, almost saying that women cannot be in the category of people, because if they were, then, like, using people wouldn't erase women. So you're saying that women aren't people. And that also reminds me of, like, an analogy, like an analogous argument to this, like, really common TERF argument that deals with race, that I think, like, we could all agree on, like, would be racist. If we're talking about, like, flu infections or, like, just, like, I don't know, sicknesses generally or whatever, and we're saying that like the majority of flu infections in the United States every year are going to be white people. Like, white people are going to get the majority of flu infections every year because white people are just the majority of the population. And so like people of color and poor people and other demographics are going to be disproportionately likely to get, like, severe sickness from, like, a virus like the flu because of systemic racism and systemic bias and all of that stuff. But, like, if you take like the raw numbers, like, it's going to be majority white people. And so to say that, like, using pregnant people erases women would be like saying, like, if the language that we currently use to talk about the flu was, like, only white people, you know, like, if we just said, like, oh, we gotta, like, everyone get your flu shot to protect white people this winter from, like, getting the flu, and, like, all of the language that we used to describe the flu was, like, using white people, and then someone came along and was like, hey, like, this issue affects people of other races, of other racial demographics too. Maybe we should change to just saying, like, all people, like, get your flu shot so that, like, all people are safe from the flu this year.
Yeah.
And then you responded with, no, that's erasing white people, because white people are the majority of the population affected by this, and, like, white people are like predominantly affected by the flu. So, like, saying people instead of white people erases white people. Like, that is a racist argument. And I think that we can all understand, like, why that argument would be racist if that was an argument that was being made. And I think that argument is perfectly analogous to the argument that these second-wave feminists and TERF feminists are making here, which is the ridiculous idea that somehow saying pregnant people, like, doesn't include women, and, like, oh, now you're erasing women. Like, I think it sort of shines a light on the somewhat covert, but, like, still very, very blatant and shameless transphobia that is just running through those arguments.
Yeah.
There.
And it's normalized. It's completely normalized. I think that that's definitely an analogous situation that, like, really demonstrates the absurdity of what's happening here, because, like, for a lot of people who maybe, like, don't have trans people in their lives or, like, haven't thought about this at all, they do think it's completely normal to just say, like, women's rights. And that's just, like, the language that's in their brain, so that's what makes sense to them. But they don't necessarily see how exclusionary that is, and then when you point it out, they're very resistant to that. But I think that, like, that analogy helps show how absolutely ridiculous it is, because it is very analogous with the fact that, like, yeah, maybe white people are like a majority population in the United States, and so people of color are not going to, like, in sheer numbers, they're not going to be as many people of color infected with, like, say, the flu each year. However, the percentage of people of color who are going to get infected with the flu might be higher than the percentage of white people overall, because environmental racism makes you more likely to get sick. Medical racism makes you less likely to recover. And so, like, those things are disproportionately affecting people of color and not white people. So even though, like, the majority would be referred to, the other people who are even more disproportionately affected by the discrimination already happening in this are just kind of further marginalized and further erased. And it doesn't make any sense on its face, because, like, obviously white people aren't the only ones who get the flu, but it just seems so much less obvious to the general population in the way that, like, transness is constructed, that, like, obviously women aren't the only ones who get pregnant, aren't the only ones who need other kinds of reproductive health care, who need access to birth control.
Yeah.
Then I do have a question for you, just kind of a for fun question, because I want to talk about TERFs. I love making fun of TERFs.
One of my favorite pastimes. I do it every weekend.
Yeah. How do you think these mainstream media representations of gender-neutral language as erasing women, especially in the context of reproductive health care, might, like, parallel or relate to other arguments made by the trans-exclusionary radical feminist movements? Because
Oh, yes.
yeah, there are a lot of them.
I can totally talk about this. No, this is okay. This is gonna get into something that, like, I am super transfixed with. Oh God, we should start, because that's the name of the podcast. Yeah. Oh, that's wonderful. Yes. Okay. So TERFs. So I do think that, like, those arguments about, like, using pregnant people language, erasing women, like, does very, very almost exemplify perfectly, like, arguments by the TERF movement, because, like, the TERF movement not only makes those arguments, but also, like, makes other kinds of arguments that are very similar that I've alluded to about, like, trans people, both trans femme and trans masc people, being a sort of specter that is haunting women and trying to tear down, like, the foundations of womanhood. So, like, trans exclusionary radical feminists, as we call them, or TERFs, is like a sort of political movement and ideology that came out of the second wave feminist movement of the 60s and 70s. And I like to think of the TERF movement as, like, if you took second wave feminism and then took, like, the worst parts of second wave feminism and then, like, took those to their, like, extremes and their conclusions.
Is that, like, the gender essentialism?
Yeah.
The binary opposition and tension between, like,
yes,
women are victims,
exactly,
men are oppressors.
Exactly. It's those parts of second wave feminism. And you took those to their extreme conclusions, and essentially what you get is an ideology where we are going to operate under biological gender essentialism. There are two genders. They're analogous to the two sexes. There's male and female, man and women, and they are completely binary, immutable, biological, and they are in direct opposition to each other. And we live in a patriarchal society where men have the power and dominance over women. And the way that we prevent that and solve the problems that result because of that is by making women equal to men and, like, tearing down, like, male structures of patriarchy. It's this very, like, oppositional, kind of, like, grandiose thing.
And trans people disrupt and mess with that, which they don't like.
Exactly. So trans people, by existing, because TERFs can't see anybody assigned male at birth as anybody other than a man, trans feminine people and trans women can only ever be seen as, like, invasive male oppressors to TERFs. Because if you see that person, like, entirely as a man and they're coming into, like, what you would what like a TERF would classify as, like, their woman's space, then that is an invader. That is a male invader who is trying to appropriate womanhood, who is trying to, like, take womanhood away from you, a natural born woman, you know, and quote unquote, I did massive scare quotes there. I hope you could hear it in my voice. But yeah, this person is trying to take, like, your womanhood away from you, trying to turn it into their own thing. It's like they see it as, like, men essentially trying to, like, colonize womanhood in a way, or, like, take womanhood in the way that, like, men have taken everything else under the TERF worldview, right? Because the TERF worldview is all about how, like, men have taken everything away from women, and now trans women come in here and they're also just men supposedly trying to, like, take more of womanhood away from women. And then trans men and transmasculine people.
Ooh, I think
You want to talk about that? Because like there's some really weird shit that makes no sense about the way that they talk about trans
psychological
people.
stuff going on here. I don't think they know how to deal with this. Yeah, if you don't mind.
They don't know how to deal with a lot, let's be honest.
Yeah. There are like two ways that I've heard TERFs construct transmasculine people. One of them is, I think, relying on the same thing that you said about what they do with transfeminine people, where they can only see transfeminine people as men because of their biological essentialism. I think a lot of time TERFs can only see transmasculine people as women for the same reason. And so because women are inherently victims within their paradigm, these people must also be victims of patriarchy. And so the way that they construct them as victims of patriarchy is they're like, well, I think TERFs think that all transmasculine people are like just lesbians, and that they want to transition, quote unquote, because of internalized homophobia, because they want to date women and they want to be heterosexual.
Yes.
And the only way to do that is to become a man. I don't think they think non-binary people are real either. So we're only talking about like they only talk about trans men, but I think they apply this to like everyone regardless.
Yeah.
You know, transmasculine people too. And so I think TERFs often construct that as one thing of like, well, you're a lesbian and you're a victim of patriarchy because of internalized homophobia, and you think that you have to assimilate into masculinity in order to like get what you want and in order to like be heterosexual. And so they'll construct it as that. And so it always ends up where like transmasculine people are still somehow like the victims, even though TERFs also hate them. I think like somehow to a lesser degree though, because they still like view them as sympathetic figures because they have vaginas, I guess.
That's interesting because like I also think about how like those arguments by the TERF movement that we've just been talking about of like the internalized homophobia thing, especially with transmasc people, like that parallels a lot of the arguments that gay activists have made against trans people generally since like the 50s. About how like trans people just have like internalized homophobia, like you are just a gay man who doesn't think that you can be a gay man, so you want to be a woman so that you can feel more comfortable being attracted to men. But in reality, that's not that's not what's happening. And
have they ever like thought about trans femme lesbians? Because tons of those exist too.
And that's the thing. I think that's like that is like the main thing that like I've never realized or like understood, and I think that's also like why like theories like autogynephilia developed.
Oh yeah, do you want to just like explain autogynephilia?
Okay, so autogynephilia theory is this 40-year-old like psychological theory that was developed by this Canadian professor and psychologist named Ray Blanchard from the University of Toronto.
We don't like him.
Yes, very bad. So Blanchard developed what he called like a typology of like what we would call trans women today, but he didn't call them that, or just like what we would call trans feminine people. And his idea was that there were two types of trans femme people. There are what he calls homosexual transsexuals, who are exclusively attracted to men. So these are like what we would say like a straight trans femme person or like a straight trans woman, attracted to men. And he explains their gender dysphoria in like that same very like internalized homophobia way of like, their brains are like, he says that their brains are like almost analogous to like a cis woman's, and like they used to be gay men, but then they realized that they would feel better as gay men if they transitioned to a woman, and he gets that whole narrative for them. And then all other trans women are, he calls autogynephiles, and these are trans women who are bisexual, asexual, lesbian, whatever, and the transition and dysphoria of these people is not like explained by that typical like internalized homophobia narrative. So how Blanchard explains it is that these people have autogynephilia, which he literally
made up.
He literally made up. He combined 3 Greek words, like it literally is like auto, self, gyna, like vagina, and philos, love, like it's self vagina love. It makes no sense. Autogynephilia is the idea that like these trans femme people are only transitioning because they have this sexual fetish for imagining themselves as women, that like they want to like pretend that they're women and imagine themselves as women because it fulfills some kind of sexual paraphilia that they have, which is absolute bullshit. But that's like the explanation, is that like you are either transitioning because you're attracted to men and you want to feel better about it, or because you have a fetish for being a woman.
Yeah.
Which is very strange. And like immediately like what research found was that like wanting to like fantasize about like being sexy and like if you're a femme person, like feminine is like a normal thing
that like all femme people tend to do,
and like masc people do it with themselves too. Like this is like, it's like a normal thing that everyone does. It's not a fetish. And so like the only reason why it would ever be classified as a fetish would be transphobia.
Yeah.
Like, that's the only explanation for it.
Yeah.
And that's autogynephilia. And so autogynephilia is essentially like Blanchard's way of explaining like what the existence of trans femme people who are not attracted to men, and also has been like since then co-opted by the TERFs of today as a way of like being like, see, like these aren't real women, they're autogynephiles, and they're gonna come and steal our womanhood for their sexual fetish, and they just have like a fetish that they want to fulfill, and like we need to stop them. Like that is also another very common TERF argument, and it also relates back to like the sort of like central thesis of my answer to this question that you've asked me, which is that like all of these TERF arguments, the pregnant people and like the abortion of reproductive rights related language and autogynephilia and the internalized homophobia and like the why people transition, all of them are positioning trans people as somehow like agents of patriarchy or like victims of patriarchy who then like become agents of patriarchy in the case of transmasc people, who are somehow encroaching and attacking and invading women and women's spaces because, again, TERFs cannot get out of that like binary worldview of like there are two oppositional sexes.
Yeah. That makes a lot of sense and definitely relates to, I think, everything that creates these barriers for people who are trying to access reproductive health care. That gender essentialism and that refusal to be able to acknowledge that people who are not women might need reproductive health care, or that people can, like, be someone who, like, stereotypically looks like they might need reproductive health care, but, like, not be a woman. This really binary worldview is basically what's creating a lot of the barriers that transmasculine people in particular and non-binary AFAB people face when trying to access reproductive health care, on top of the barriers that everyone who needs reproductive health care already face due to the criminalization across the country.
It reminds me of a song that I've shown you before, a really good punk song from a 90s lesbian punk band called Tribe 8. That's called Wrong Bathroom.
Oh, yes.
Yes. And like the entire song is about this self-identified dyke lesbian butch who like walks into the women's restroom like everywhere they go, and like they're constantly getting told by like the cis women in the restroom like, wrong bathroom, like are you sir, ma'am, are you in the right bathroom, like the men's room is over there, like constantly like getting told that they're in the wrong bathroom. And like the entire song is just like this speaker being like, do I need to like show you my boobs or something so that you can like see, or like do I need to like prove to you that like I like if there's only two restrooms, like I'm gonna go in the women's one.
Yeah.
And it's like, I think that to me just like very much exemplifies in sort of like song format how this weird reaction of cis people to trans people, quote unquote, like invading women's spaces, sort of how that feels as a trans person.
Yeah.
And how that, and like what that experience is like. It's a really good song. Absolutely go listen to it.
Yeah, and like the hypervigilance that creates in needing to try to perform a specific kind of gender presentation in order to like exist in the space that you're in without getting that kind of harassment, because that is often another strategy that transmasc people use. And I think I want to get into the strategies now that we've talked about those barriers.
Absolutely.
Yeah, so in terms of strategies that transmasculine and non-binary AFAB people usually use to try to get reproductive health care, to try to access that and navigate those spaces, even though they are hostile to us. The same article published in the International Journal of Transgender Health identified two more strategies that are especially relevant in the context of reproductive health care. Those are self-advocacy and strategic disclosure of trans identity.
Oh, I've heard you talk about these before.
Yeah. So strategic disclosure of trans identity is, I think, particularly related to what we were just talking about, which is in a space that can only see you as a binary, as on one side of the binary or the other. You kind of have to pick which side you're going to be on strategically in your presentation, in your behavior, in your disclosure, and if you have that ability, that is, because for people who can't pass, which is a lot of us, and I don't think we should have to, that isn't always an option. But for people at a stage in their transition or who are otherwise just able to either like present as masculine as possible, whether or not that like feels aligned with their actual gender presentation. In order to obtain gender affirming care, they might have to do that, but then in order to obtain reproductive health care, they might have to present more feminine or downplay their transness or strategically not disclose like their actual name if it's different from a dead name or their pronouns in order to get access to reproductive health care and to not be denied that. And so it's like you almost have to pick what side of the binary you're going to fall on in these spaces.
That makes so much sense as like a strategy that would exist. And I especially just think about how like one of the things that can mitigate like the need to use that strategy is the informed consent model.
Yes.
Like that is it's like right there.
With reproductive health care though, that's not usually implemented though.
Mm-hmm.
Is especially in the context of abortion, like informed consent would be wonderful, but it's completely illegal in most states in the US. You need to actually
Yeah. That makes me so incredibly angry.
The majority of states in the US have at least ultrasound laws at the very least, which is that if you go in for an abortion, you can't just
get an abortion.
You can't just like talk to your provider about the abortion and then get one. You have to go through all of this emotional labor, and the provider has to show you pictures of an ultrasound. They have to talk to you about...
That's right. They just shove anti-abortion propaganda into you.
They're legally required to. Even doctors who are pro-abortion, like, they are legally required to in most states.
Fucking God.
Yeah.
That makes me so incredibly angry.
It's infuriating. And, like, informed consent would be wonderful in the context of reproductive health care. And I think it would ameliorate a lot of those terrible choices that trans people have to make about, you know, what side of the binary do you want to fall on when you're, like, a non-binary person or a trans person. That's kind of the whole point. I think it would make that better, but unfortunately, like, informed consent models are literally impossible because they are illegal and doctors will get prosecuted for them in most states.
Yeah.
Yeah.
That's awful. And that just makes me like so like angry and also motivated to like fight for the idea of like implementing like informed consent gender affirming care everywhere possible and like implementing informed consent reproductive health care everywhere possible, because that gets rid of any pressure to like pass or present a certain way, because you know when you walk into a clinic that you have control and complete control over what is going to happen and what you're going to get.
Which is how it always should be in matters involving like something you're going to do with your body.
Incredibly like radical idea, right? Like wild, crazy. No one ever, who would have thought of that before?
I mean, I know you're being sarcastic and like that makes sense because it isn't really radical, and yet bodily autonomy is treated like a radical concept.
I felt that the whole time, that like it makes sense why the things haven't been implemented because of the like systems of power at bay, like the systems of power that are at play here, right? That like obviously like everything that we're talking about is really bad for the current systems that exist, because the current systems that exist thrive off of homophobia, transphobia, gender discrimination, racism, classism, all of those things.
Yeah.
But I also think that what those systems have done, and maybe like one of the other reasons why it's so hard to like implement something like informed consent nationwide, is propagandized their beliefs and ideologies and made the awful systems that we currently live in seem normal. One of the things our systems are really, really good at is perpetuating themselves and reinforcing themselves and maintaining themselves, not just through like subjugating marginalized populations, but through making it seem like all of that's normal and fine and well.
Yeah, definitely. And for the people who it's not normal and fine and well for, who are experiencing the discrimination, like when they speak up about that, when they talk about that, when they bring things like how gender inclusive language might be better to providers' attention, to reproductive rights activist attention, like you. I mean, we've talked about the pushback that happens because a lot of the time the people who in those positions are not experiencing that discrimination and they don't want to hear it because it benefits them to not change anything.
Yep.
Yeah. I think, the last strategy that I want to talk about is self-advocacy.
Yes.
Yeah. I'm really passionate about this.
The form that you made.
Yeah, I'm going to get there.
I love the form. It's so good.
Very passionate about this, and it sounds really simple because it is. Self-advocacy is something that you might consider like obvious. Like, of course, you're going to advocate for yourself if you're in these situations. But to me, it's done right when it's not placing the onus of explaining yourself and doing that emotional labor on the person who's advocating.
Hell yes.
A lot of the time when we say self-advocacy, what people think that we mean is well, you have to explain yourself and you have to justify yourself and you have to sound really convincing to your doctor.
It's
and
like you have to be fighting constantly all the time.
Yeah.
Yeah.
Which is a thing that people feel like they have to do for good reason, but that is not what I mean when I say self-advocacy. There are resources out there, and I have made one of them, which I will link in the description.
Yes, it's so good.
Yeah, thank you, that enable people to give their doctors the information that they need to fill that knowledge gap. And if their doctor is well-intentioned, that can actually help a lot with this process, that also don't require that person to do the emotional labor of explaining themselves and educating their providers. So one of those resources, I want to talk about Jack Kami's work a bit more again. They have a fabulous website called We Testify. It's an abortion storytellers organization. There are people of all backgrounds, all identities. Jack Kami, as a non-binary reproductive rights activist, founded this specifically to tell the kind of abortion stories that do not get told. And people can volunteer to share theirs anonymously or attached to their name. And there are tons of trans stories, tons of queer stories, tons of stories from disabled, marginalized populations. And We Testify is basically a network of people who have had abortions trying to help people who want to get access to abortions.
That's incredible.
Yeah. We Testify has access on the website to funding resources, to informational resources, and mostly it is like a support network of people helping and sharing the strategies of self-advocacy that worked for them so that other people can use them.
Oh, wow.
Yeah.
That's like the website that you built.
Yeah. My website is a collaborative resource directory. The point of it is that whoever you are, whether you are an ally, a trans person yourself, if you know of any resources that would help genderqueer people find access to gender-affirming reproductive health care, you can send those resources to me through a pretty easy to fill out form on the website, and I will upload them to the site. I have resources for genderqueer people. I have resources for providers. I have resources for family. I have mental health resources in general because that is important while navigating all of this. And I have resources for funding for all of those things that you can help pay for it because, unfortunately, all of this is also ridiculously expensive a lot of the time. And this site is basically meant to emulate what Jack Kami is doing, and it links to their website as well, which is kind of the inspiration for it, which is create a network of people so that self-advocacy gets easier so that you're not alone and you're not only advocating for yourself and you're not the only one doing the emotional labor. So I created this self-advocacy form that is on the website, and it's a form where you can put your preferred name, your pronouns, preferences for gendered terminology or non-gendered terminology that you're referred to with, and it has the AMA Journal of Ethics General Guidelines for Gender-Inclusive Practices in it as well, so that your provider can have that in your chart. You can give it to them. They can know all of that information and understand it when they interact with you, but you get to fill it out ahead of time. So you're not sitting in their office wasting your whole appointment just trying to explain yourself to them. They understand what you mean, and you can actually spend the appointment getting the care that you need and talking with them about the things you came there to talk about. Yeah.
That's so wonderful. And that also just like, I think that fits into like what I've always felt to be one of the most effective forms of activism and advocacy generally, which is something that is underground and outside of the systems that be, and subverts the systems that be, because like you're not going to find a like comprehensive like information, education, and like resource network for abortion for marginalized people anywhere unless we as a community of queer people across this godforsaken land make it ourselves.
Yeah. And I think that's also, I think, the most powerful and fulfilling form of activism for me, too, is activism done, like, by the people who are marginalized for the other people who are marginalized.
And ties into one of the broad themes of this episode of autonomy and self-determination. We are taking our care and our bodies back into our own hands, and we are subjects creating culture and creating these systems, and not objects that are just receiving oppression.
Yes. So yeah, I think we can take away from this that unfortunately within the current system, you can interact with the medical system as a transmasculine person or as a person seeking reproductive health care, but not both, because you won't. You can have one or the other. So have fun choosing, which sucks. But we can fight against that. We don't have to engage in this constant behavior of either overemphasizing gender presentation or undermining gender presentation and trying to navigate through deciding when to disclose or not disclose trans identity, because that's a temporary strategy. That's a method of survival and of staying safe in this system, but there are ways out there to find better ways of existing, better ways of getting gender affirming care, better ways of getting reproductive health care. And I sincerely believe that like when we work together to get those things, we can actually make our own lives better without having to rely on these systems. So yeah, I will link in the description that self-advocacy form I mentioned. I will link my website. I will link Jack Kayemi's website. And if you would be willing to link some DIY HRT info.
Yes.
And then also
Absolutely.
those songs.
That's such a good idea. I will do that. This has been a wonderful conversation. I feel like a lot of what I'm taking away is just like we have these like running themes with that quotation from Men in Place, that quotation from Levi from Men in Place of I don't have one way to be. And that follows with those barriers of feeling like you have to choose between actually like expressing yourself the way you want to or getting misgendered or getting denied care. And there's that. There's been this theme of self-determination and autonomy that we've talked about, from the informed consent model to DIY HRT to the reproductive justice self-advocacy. There's been this running theme of like the ways that anti-trans arguments have influenced each other over time with like the TERF movement. I don't know, it just feels like I feel like we've created this like complex, very entangled web of knowledge that feels really intricate to me in a way that I really like, because it feels very tangled up and very complex, but in a way that makes it feel so real to me.
Yeah.
That like this isn't something that can be like so easily bottled up into like clean narratives with clean solutions. It's just very complicated.
There's not a way to diminish like the real people who are experiencing this and their real experiences, and there's not a way to simplify any of the systems that we're existing within, because they are all complex and convoluted and difficult. And I feel like ultimately just having a support network, being able to navigate it, being able to have those strategies is really essential for like not just like trans survival in the medical system, but also like, yeah, trans autonomy, trans self-determination, and like ultimately that self-fulfillment that comes from it.
Yeah.
Yeah.
And I feel like above all, also from this episode, I think maybe the biggest thing I've gotten from this conversation has just been, it's almost been like a how-to manual on erasing women.
Yeah.
And I think that's great.
Oh man, that's what I was going to say too. That's what I wanted to end with.
That's wonderful.
I am so transfixed on erasing women.
Oh God.
Now that we have the right button,
what do we name the podcast?
Something trans, something praxisy.
Yeah.
Podcast name. Oh, that was nice. Is that the name of the podcast?
Yeah. I think so. Welcome back to Yeah.
Don't think it's gonna work.